Hi, friends. Today's topic is debridement codes, CPT codes 11042 to 11047. So the wound debridement are reported by depth of the tissue and measurement. So this two type is mandatory to report this 11042 to 11047. So this requires documentation of both measurement and depth of the tissue. For depth of tissue, is example means subcutaneous muscle bone. This is the deepest level removing from the wound. In order to report CPT 0104247, the debridement must extend below the dermis. So below the dermis only will view these two types of codes. So when the depth is same and different anatomical sites will give total tissue removed. For example, the multiple wounds, some the surface area of those wounds that are at the same depth but do not combine some from different depth. If different depth is performed, will give the deepest level of the debridement. For example, bone is removed and muscle is also removed. We'll give the deepest level is bone. So we'll give only bone removal codes. Medical review denial reasons. Mostly they will deny for medical necessity and the depth. If no description of tissue removed, for example, subcutaneous muscle, bone, nothing is there. There is a incomplete documentation. So we need the depth level, which tissue is removed. So we need the documentation should be subcutaneous was removed, muscle was removed, or bone was removed. If it is not there, we have the denial reasons.